accreditation survey process before the surveyors arrive. I could have almost started with the accreditation survey process after the surveyors leave, because what we're going to go over has to do with what we really do between surveys, or what one would call continuous readiness. Before the surveyors arrive, we have quite a few responsibilities. In fact, we have so many that really it's impossible to do all the things that we need to do for survey a month, 3 months, 6 months, even really a year before the surveyors arrive. We need to be doing many of the things we're about to go over on a continuous basis. And if we're not, we're going to find ourselves falling short in areas and really going through sort of a chaotic survey process. We're going to start off about documentation. In fact, I'd make yourself a cup of coffee if you haven't already and come back to the presentation here, because we're going to talk a lot more about documentation on this presentation. Really, documentation is the key, and a lot goes into creating documentation. It is it's probably one of the reasons why I focus so much with you all on when you all write reports or when you all do your discussion boards on your documentation and your formats, because documentation is so key and vital to the success of the survey process. And we really need to be excited about it at times and engaged and really come to enjoy documentation. I think that if you really, truly hate documentation, you really should consider not being in the healthcare facilities leadership world, because it is such a critical part of what we do if you're going to do it well. First documentation you want to talk about is management plans. Management plans are not required by every accreditation organization. The Joint Commission does require them, and others do as well. I believe they're an excellent document that we should have. These plans are a high-level overview of your department. What do you do, and pretty much why do you do it? They should be reviewed annually. They really need to be submitted to an organizational committee over safety, or maybe risk management or performance improvement. This allows you to ensure that you're integrated in the organization. It also allows you to look at your scope on a continuous basis. Scope can change. Sometimes your bed size can go up, sometimes your bed size can go down. Sometimes you add services, sometimes you decrease services. Sometimes you add new and unique equipment, and sometimes you lose equipment. Sometimes your community will add industries, or maybe crime will change in your community. Maybe you have an increase in gang activity. And in some cases, maybe you have a decrease. But for all those reasons, you need to be looking at your scope of work and scope of responsibilities and adjusting that in your management plan. This is also the place where you start talking about performance measures. How do you measure what you do, and how do you know you're doing a good job? Performance measures, there are standard measures out there across our industry, but this is an opportunity to also identify performance measures that are unique to your facility or to your staff, or things that you're engaged in trying to work on or measure. I think this is a wonderful opportunity for new students coming into the industry to move, if you will, our profession forward. You also want to reference codes and standards and regulations. This is a high-level mention. You would mention the whole code or standard. You'd mention, NFPA 1999. You would mention, Life Safety Code 101, 2000 version. You'd mention those high-level versions of codes and regs that you use and follow, but not the detail in your management plan. But a very important document. It's sort of a guide document to how you operate your department.
Documentation, statement of condition. For those of you who have recently emerged into healthcare facilities, this might be a little bit foreign to you. For those of you who have been in healthcare facilities for a while, obviously this is something that changed in recent years or very recently. It has to do with the statement of condition. That's language that predominantly came from the Joint Commission. However, I think for the sake of this conversation, we can accept the statement of condition language as being taking it for what it sounds like, and that's the condition or the statement of the condition of our buildings as it relates to life safety. This documentation at this point in time is something that I'm putting under recommended to have for your buildings. And particularly, it needs to be done for buildings or should be done for buildings where patients cannot self-preserve. This is pretty much hospitals and ambulatory surgical centers that have one or maybe four or more, depending upon code, people who cannot self-preserve. Could also be cancer centers, things like that, where people are locked in a position or unable to move for whatever reason for a period of time. Um, but the statement of condition is something that now we have to address in a different way. It still does exist. The Joint Commission still does supply a document called the Statement of Condition. And again, what this document does is it goes through all the different life safety codes as it relates to doors and um, egresses and distances and even occupancy level and building type and construction type and things like that. And it was a great document. I cut my teeth on this many years ago. In fact, I still work on trying to embed something like this, if not something similar to this, into the course so you can get a better understanding of the complexity and the comprehensiveness of a statement of condition. But you need to do that you need to be doing that. I think there is a recommendation to do an annual life safety review of your building. And this document still does reside out there somewhere where you can still use it. Some of these are electronic, some of these are paper. Now, when it comes to your other healthcare facility types where people can self-preserve and they're much more basic buildings, we have their healthcare, you still need to do it. There's still life safety. Um, there's still issues to be addressed and be aware of, and you need to still do an annual review or review of these buildings when it comes from life safety code. But it is much more basic of a document for those buildings. I mean, in some cases, they're just looking for construction type, and they're looking for occupancy and some basic square footage and information like that. Again, mention this must be reviewed at least annually, and that most are now currently electronic. I believe back in the day, the Joint Commission, you could fill it out electronically. They would house it for you. In fact, back in the day, they would say that it was for your reference, and that the surveyors would only look at it before they came to your facility or when they arrived at your facility. I am told the Joint Commission wants to continue this for those who are Joint Commission surveyed, and that they won't look at it. It is all purely for your reference. I mentioned waivers as well. As code continues to evolve and as buildings continue to have different generations of construction, sometimes your building just cannot be in compliance for changes in code. And dependent upon your authority having jurisdiction, your locale, your regulations, you may have to seek a form of waiver from your authority having jurisdiction to have your building continue to operate and be okay. One of the big changes that has happened in recent years is the conversation about how big can a smoke compartment be, or how long can the distance for egress be. And buildings are built, again, based on code that may vary building to building to building based upon vintage of when it was built. And therefore, as code changes, sometimes the building that was built in 1974, 1982, or 2005 might not be able to be structurally changed to meet what's current. So you get these waivers so everybody understands that it's an exception, if you will. So you need to have any waivers that might be needed for your particular building or even particular section of your building. You need to have those documents ready as well. The next slide. Now this is interesting. When it comes to the next slide, back in the old days, we had a thing called a plan for improvement. You could be transparent, and you could take life safety issues that you identified on your statement of condition, and you could create this thing called a plan for improvement. And interestingly enough, they would give you a 6-year window to address those issues and during construction in the future. However, if you couldn't get them addressed in that 6 years for whatever reason, you could opt to get an extension for another 6 years. So in theory, you could have up to 12 years to address some life safety issues. One of the big issues back in the day, and still today, to this day for a lot of buildings, has to do with fire dampers. Getting access to fire dampers based upon construction or what's in front of them or over them, on top of them or around them, could be hazardous material like asbestos, even could be plumbing and pipes, and just difficult to get to. That that those would be put on a plan for improvement, and you would wait until you got construction or construction money and got to that area and took care of it. That changed. And when that changed, basically now they only give you 45 days to address any life safety issue. I have a comment here, or 24 hours. And that is really, if you either have to remediate things within 24 hours, or you have to put things into an ILSM, inner life safety measure, and you have to document it. And otherwise, if you do that, you can do that up to 45 days. There is a mechanism to exceed that. It is something that is, most of us don't want to go through the process if we have something that is going to go beyond 45 days. So really, the pressure now in code is to get it taken care of within 45 days, and 24 hours for easy fixes. And again, that 24 hours does vary by accreditation organization. I think DNV says within 24 hours. I believe Joint Commission says shift +1. So in any case, but you have to have this documented. All of this must be documented. These 45 days, these 24 hours, whatever it is, you have to have good documentation. The question really is, when it comes to documentation, was transparency better? When we had the statement condition with the plan for improvement and we were able to disclose the issues and have a period of time to take care of it, there's a question out there, were we more transparent and say, yes, here are issues we have in our building? Whereas today, is it possible, because of human behavior and just the nature of people not wanting to get in trouble or whatever it might be, or spend money even, people may not be as disclosing when you have only 45 days to take care of an issue or a lot of work. So I think that conversation is going on. That conversation will continue to go on. Was the old way better? Is the way we're doing it currently the better way? And I think time will definitely tell. It is important, of course, to have all of this organized in a binder, and you really want to have anything that you had over historically, you want to have it there. You want to have the old things that were taken care of. You want to have new things that have shown up between survey. It just shows a track record, and it shows that you've been paying attention to this for a long time. And of course, as time goes on, the better that history looks, and the surveyor is just going to see just how organized you are if you have year after year after year after year of paying attention to these issues, and that's going to put them at more ease with you. Like anything else, the better the documentation, typically, and the more organized it is, the surveyors are just going to relax, and it's going to be more educational of a survey, and that's true pretty much of any accreditation organization. I make a comment here. Don't forget fire authority contact documentation when it comes to interim life safeties, and this is mentioned in other parts of the course. The requirement to contact your authority having jurisdiction and let them know and have that documented about whatever interim life safety measure, life safety issue you have is a requirement these days. I think the mechanism for doing that is having to be developed. You need a good relationship. When I say fire authority, it's not necessarily authority having jurisdiction. Code authority, it very possibly could be the fire department or the fire marshal or whoever is defined as the fire authority. And don't forget that that probably should be mentioned in policy somewhere as well. Again, this section here with the statement of condition and PFI has transitioned in recent times. We are in a new world that is much more immediate response, but it's very good information to understand as you manage multiple buildings and as you manage hospitals.
Policies and procedures. This is one of those areas where I think that many of us can always get better at it. I think that there's also an opportunity for the networking within our profession to get stronger. You see a lot of questions on the listserv about policies and procedures, people seeking policies and procedures. You want to make sure your policies and procedures are updated, that they have a good date, timestamp, that they've been reviewed recently. You'll want to make sure your staff have awareness about your policies and procedures. And really, you want to do what you say and say what you do. The key here is to make sure that you do not go below minimum regulatory standards and requirements, but you keep it simple. Be careful borrowing policies and procedures from others that look really good and sound really good, but don't necessarily fit what you do. It's better to just keep it simple, Again, do what you say what you do. Make sure they're organized and accessible, and that they do not contradict other policies and procedures within the organization or within your system. And that's where the integration comes in. It's a good idea that to compare and share policies and procedures with other hospitals. Sometimes this can cause some problems because some people hold on to their policies and procedures and don't like to see them changed. And it's hard to sometimes adapt others' best practices when we think our practice is the best practice. But it's important to integrate these to make sure that you support each other if you have several hospitals in the same system. Risk assessments. Risk assessments really are not used probably as frequently as they should be used, but they are being used more frequently because we're finding that they are ways to help us do more meaningful work. They protect us from legal issues. They increase productivity. And surveyors really like them. They like it when we put on our critical thinking hats and we evaluate what we're doing and we assess it for risk. There's no doubt that if you have a piece of equipment sitting in an office in accounting versus having a piece of equipment sitting in a critical care room, those are two completely different environments. And that piece of equipment that sits in that office, we may never look at it. We may never check it. But that critical care piece, we may check that 4 times a year or maybe monthly. And that's the kind of risk, that's the basic ideal of risk assessments, that you've evaluated your systems. You've created a risk assessment that's based on some good thinking or really good data. And then you're able to say, okay, here's why I do what I do or don't do what I do. And hopefully that leads to, again, better productivity, more meaningful work, and certainly protection. That you want to, again, make sure they're justifiable, and really make sure your staff knows about your risk assessments and why the same thing. Make sure they understand why they do some things in some areas and don't do other things in other areas. This is a really important part of staff training. Maintenance records. If you have a good computerized maintenance management system and you have a good computer user and your technicians are good putting data in and you have a good way of pulling reports and you're optimizing your maintenance management system, records become a much easier process. Unfortunately, a lot of folks have these computerized maintenance management systems but really don't utilize them to their potential. As a result, they often have lots of paper records as well. Now, I'm not going to knock paper records down all the way because paper records have a place and they can be very, very helpful for us to use, especially for checklists and such. Certainly we need them for surveyor preparation and for review. But at the same time, I do believe that a lot of folks still manage way too many paper records. The information, whether paper records or computerized maintenance management system, need to be detailed information from the staff. You want to make sure that you notate your in-house work order number with any vendor work order number or work order, so you're tracking issues. Lots of times a vendor will come in, they'll do a service, and something will be found during that service, and we got to make sure that we identify that issue and that we track it through, because again, that equipment is our equipment. We have ownership of it. We're also responsible for contractor activities and records. Just because they say they PM something or because they say they've addressed an issue, it doesn't necessarily always mean they understand the codes and standards we're held to. So you have to make sure that they are doing things by codes and standards. A classic one that I remember back in the day was we had our fire system being inspected, and during the inspection, really we didn't find out till later that they were not checking our shutdown devices on our air handlers during the inspection. And the reason why was because the shutdown devices were actually not tied into our fire system. They were separate island or siloed shutdown devices. And this particular vendor said that, well, we only test items that are part and tied into the fire system. We don't test these separate components. Well, that got caught by a surveyor, and, of course, we remediated it. We took care of it. We had to rewrite the contract to include it. But, that was required. It's right there. It's required. And we just assumed, hey, they know that we have to do this. And they weren't doing it. And so it took a surveyor to point it out that we needed to get that covered. So there's an example of where here's a vendor you assume knows their job. They're a fire panel testing company or a fire equipment testing company, and yet you have a big miss like that. Again, always make sure you have your project documentation as well and keep those records in nice order. I know lots of places do small projects in maintenance, whereas large projects go off to maybe a construction management team within your organization or otherwise, you still got to make sure you have that project documentation in your records. Drawings. Drawings is a big subject because a lot of folks are managing so many different ways today, whether it's an electronic CAD measure way you're doing it or paper documents. I think most of us still deal an awful lot with paper documents. There is a day, I'm sure, coming where we will deal with few paper documents when it comes to drawings, but I think we're stuck with paper documents for a very long time. And one of the complications with paper documents is there's so many revisions of documents during projects that to actually put your hands on the as-built and have those organized in such a way for your staff to use, I think is an ongoing challenge for many facilities around our country. Just tracking building changes over 50, 60, 70, 80 years is a challenge. But you want to make sure you have those drawings because the surveyor may want to look at those drawings. You want to make sure you have life safety drawings, which show compartmentalization and fire features of your organization, and your utility drawings, which are required, and your floor plan, just a basic floor plan for the surveyor because they're going to want to see that floor plan to navigate your organization. Quality documentation. I put down here greater than 1 year's worth of data. If it's less than 1 year's worth of data, it really doesn't have any real trending, so it's hard to use. In fact, it typically won't be accepted as quality data. It's important to understand that that if you write a summary each month and you look at your data on a regular basis, write a little paragraph, did it change? Was there a trend? Was there a variance? Then you can track that month to month to month, and those variances will often add up, and then you can start following up on these things and make it more meaningful. If you do that, that's a nice cycle, and then as you find issues, you can create staff awareness. Your staff will be aware, then you can correct these issues or adjust these issues, and then take credit for it. And you can use those for later on for the next subject, performance improvement. Performance improvement should be an ongoing, and it really comes from quality. When you're measuring your quality or if you're measuring meaningful work, you're always going to find opportunities to make things better. And again, this is where the ideals aren't necessarily always your idea. These ideas can often be staff ideas. And as you're looking at data and work orders and quality, and these things come together, or you have incidents, or maybe you're doing risk assessments, you can pull together, something to work on. Again, a performance improvement project. Now, keep in mind, performance improvement, it cannot be used to meet a regulatory minimum. So let's say, for example, you're meant to do risk 1 PMs on equipment at 100%, and you have found during your quality for several months, you've been trending at 96%. And so you say, we're going to do a performance improvement initiative, and we're going to bring our quality up to 100%. Now, internally, that is a performance improvement activity. But from a regulatory perspective, that's a violation. So really, you cannot use those for, improving. Now, let's say, for example, you have a regulatory item of doing PMs on risk 1 equipment, and you're doing it at 100%. But you see a trend that there's a problem that keeps showing up on the PM repeatedly, a repair or something like that, or some issue. Now that can be turned into performance improvement activity, where you improve the process or you improve the PM issue. Make sure you track and record your history, that you write a regular summary again, and that you follow up. And again, make sure your staff's aware of all this work, and that you tell the story, and your staff can tell the story. When you make changes to improve things, your staff should be able to articulate that story, and you want to be able to tell those stories as well. In fact, the more stories you collect, it just makes it, again, it really, really helps the surveyors and helps your survey process when you can tell stories and your staff can tell stories. Other hospital activities before surveyors show up. The thing about before the surveyors show up, everyone sort of, especially 6 months, 3 months in before they show up, people start to get very, very different about their areas. And this is one of the reasons why you really need to be going continuously, being prepared for survey, because the closer you get to that day, your time will no longer be your time. Your time will be spent helping others. And here's a list of things that you'll be addressing. Aesthetics become just kind of a constant drumbeat, from painting to ceiling tiles to flooring to chairs to, you just don't know what it's going to be. There's so many aesthetic issues that start cropping up, and you end up having to prioritize what you need to do, what you can do. Clutter becomes another big issue. You'd be surprised how many things that people need you to store long-term or short-term, or they're just getting rid of which leads to storage issues. You'll want to make sure long before you get into the accreditation cycle, especially the last 6 months, that you have your storage areas all cleared out, because inevitably they're going to get filled up. And you want to make sure you have a good process of getting rid of things. One of the ways to address this is to participate and be engaged in environmental rounds and administrative rounds. Environmental rounds should be going on all the time between surveys. Administrative rounds typically start to happen leading up to survey. But be involved in both. It's a great way to make your job easier on the long run. Also, before survey, you want to make sure that you're taking a good hard look at your projects and your contractors and your vendors. Because your projects, your contractors, and your vendors are going to be very important when survey happens. You want to make sure that they know survey is coming. Very often, project management folks particularly, they don't want to be around when surveyors are around. You'd be surprised how much they can, how they disappear when they know the surveyors walk in. And you may have certain contractors and vendors, you don't want around as well. Let's say, for example, you have vendors in the hospital that are pulling cables. Well, you want to be sure to let those folks know that if there's an announcement that the surveys have arrived, that they're going to be put on project hold. In fact, it's probably a good idea to try to get as much of that out of the way before surveyors arrive anyway, because you never know what kind of problems they can create in the survey process. Same thing with vendors as well. Now, your documentation and the presentation of your documentation, we've spent a lot of time looking at all of this documentation. You really want to make sure that you've compiled it and you've placed it in binders and it's organized, has easy flow. You also want to make sure that your staff is aware where it is, because there's a possibility, you never know what's going to go on. It could be a wedding, a birth, a vacation. Although many times the hospital will tell critical people in critical roles they have to cancel their vacations as much as 3 months out before survey could occur. So you want to make sure that, but the things still happen. You may be on vacation. Again, if you have a great running department and you have trained your people well, in theory, you don't have to be there. Although really, as leaders, we should be there, if at all possible. The other thing is a checklist. And I'll talk about this again later, but know thyself. Each department have certain issues that they have to address that are specific to their environment. We had a survey readiness checklist, and that checklist was on a clipboard. There were multiple pages. And then when the surveyors showed up, the staff would just take a sheet, and they were pre-assigned, and they would go check things just to validate, to make sure that there were no issues in certain areas, certain common problem areas in our organization. This is a valuable tool, and I would encourage everyone to have a survey readiness checklist for survey that they kind of crack open the day the surveyor walks in. Because again, if you take your staff and you spread out, you can just get rid of a lot of minor little gigs by doing that, especially if you know your environment well. But that's an excellent tool that I would recommend. Accreditation organization trends. Again, before survey, you'll be wanting to read a CMS report. We're going to be going over that in our course. They'll tell you about what the survey organizations are focusing on. You'll want to talk to other hospitals, because the other hospitals will have some insight as to what the accreditation organizations are focusing on. And then organizations' literatures and presentations. George Mills was always famous for going to his presentations. He'd tell you straight up what they're looking at this year. And so you can focus on that. The surveyor themselves, I'll tell you what, there used to be a lot more pet peeves and trending with the surveyors by personality. It's not quite that way anymore. I think they're better trained. I think that they're following marching orders from the organizations better. I think they're more focused, which really they don't vary quite as much as they used to. But they still do have some pet peeves. Again, they're people like anybody else, especially if there's something going on nationally. If there's flooding or abductions, OR fires or shootings, or something major has happened in our country. They come in with sort of a mindset, thinking about, well, hey, have you been thinking about this? What did you do when you heard about this on the news? Have you done anything at all? Have you discussed it? And so that can be, that can be something that could affect you, and the surveyor may bring to the table that you just weren't preparing for necessarily. Again, I told you continuous preparedness on the front end. On the back end, that's really what it's about. None of this can really be done in a short amount of time. It has to be something that's planned out over a long period of time. And if you don't do it over a long period of time, then when you come to survey time, you're going to be feeling vulnerable, and you're going to be wondering what you didn't do. But if you've done this in between survey cycles and you do this on a continuous basis, again, you have a nice tightly weaved basket, and I believe that for the most part, you'll be able to get through survey very, very, very successfully. Again, this is the biggest portion. Next thing we're going to do is we're going to talk about when the surveyors arrive.